You know, guys, we talk a lot on the show about health, with internal health, external health, what you eat, working out, but you really sometimes just got to take care of some of the things you don't think about too often, like your hands. They're just there. They do what you want them to do. But according to Miss Hima Dalal, this pretty lady right here from Vital Energy, that isn't always the case. Sometimes they don't quite listen to you.
We are constantly using our hands since we are born. This is the first thing that the child learns to use because it's necessary for us to eat. There's so many things these hands can do. They can pray, they can heal, but without the hands, there's so many things you cannot do. And we take it for granted. So overuse syndrome can cause the hand
Overuse syndrome?
Yes. Or sometimes just using the hands with the wrong body mechanics, or constantly you are, maybe your occupation is like that, you're a dentist, surgeon, or you are just a labor person who are doing a constantly repetitive job with the
Now, is that you're talking about like carpal tunnel syndrome?
So you can get the carpal tunnel, you can get the arthritis set in, your joints will wear out. Sometimes the joints will lock up on you.
You mentioned that just a few minutes ago. What does that mean? Your hands will actually lock?
So the fingers starts locking up, your thumb starts locking up, and what it does is most of the hand mechanism works. It's like a pulley system. So if this pulley gets a lot of adhesions and a scar tissue, it's not going to work. And it locks up, and it's very painful.
So if that happens, if my hand locks up, how do I force it open, or what do I do?
You try to do that, and it's so painful. And imagine you're trying to grab something, and your hand locks. You can't let it go. And it's hot. It can be very cold, whatever, but you can get stuck.
That could be potentially dangerous,
and it's not functional either. So occupational therapists are very well trained to prevent all these conditions. And if you learn early enough that how to take care of your health, of the hand, as well as do the therapy. Therapists can treat the hands to prevent from locking, prevent from having tingling, numbness, pain, deformities that develop in the hand. Then your hand cannot close and you cannot use them. So there are a lot of things occupational therapy can provide. It can be a splinting, it can be even a laser treatment, it can be a fascia release, it can be...
Real quick, is there anything we can do at home just to make sure our hands stay healthy? Can I do this? Walk around and do this?
There are things like you soak your hands in Epsom salt warm water, you put a sponge in it, you squeeze it. That's a good mobility exercise for the hand. You can also learn how to stretch your hands.
Just like that?
Yes. Also repetitively, like don't use the same motion. Change the position differently.
Got to stop right there. Miss Hima Dalal, Vital Energy, hand health, guys. Keep these things going so you can wave at your mom and dad and stuff, just like that. Stay with us. We're going to put links for you at abccolumbia.com.
Thank you.